Hello, my name is Kathryn Huntley, and I'm proud to co-author and represent the co-authors for publication 3615, From Survey to Resource Hub, Chronic Lymphocytic Leukemia Global Support. Our poster can be found in the outcome research area of the poster pavilion in lymphoid malignancies. The survey and the paper has been put together by 6 representatives of a global network of chronic lymphocytic leukemia patient advocacy organisation. There is 1 representation of a global provider of analytics and clinical research services. 3 leading hematologists in the field of CLL were also a part of the authorship, and Nick York led on this piece of work. The aim of this work was to identify a global network of organisations which provide support services and resources to people affected from CLL, in the hopes to understand, map, and inform opportunity for global connection, shared learning, and to build shared expertise. The global survey was carried out in 2021 and led by the CLL Advocates Network. The purpose of the survey was to collect information about CLL support provision by these organisations and what the needs were worldwide in service provision, what available resources were available to people impacted by CLL, and what the unmet need of these organisations were seen as. It also provided an opportunity of understanding and representing global insights to inform the CLL Advocates Network on strategic opportunities to improve capacity more globally. One of the key deliverables of this survey was the creation of a global resource hub, which is a searchable directory of CLL support services and resources, which can be filtered by organisation and location. We undertook preliminary desktop research to identify patient advocacy organisations which had CLL in their remit. The invitation was to take part in a 63-question web-based survey between May and August 21. The survey was available in 7 languages. Outreach was to 158 organisations representing 69 countries, which included both member and non-member organisations to the CLL Advocates Network. Response was a 36% response rate, and the imagery geographically represents the contribution and participation in the survey. Key findings found that these organisations provided patient meetings, awareness campaigns, educational events, and telephone support as core parts of their services. Less likely were they to have provided technical online health resources, which probably speaks to the barriers that we identified, which included financial resourcing as a barrier to their capacity to deliver services, as well as personnel, whether they be paid or volunteers. These groups saw the CLL Advocates Network as a key provider and leader in sharing best practice, bringing people together in networking campaigns, and providing regular updates of the CLL community. They also saw that their topics of interest included CLL research, clinical trials, and medical updates. In conclusion, the recommendation that we have found from this survey is that there is a need and demand for participation in networked activities across patient organisations, and there are many countries where there is a gap in support service provision, mainly due to infrastructure. We identify that our healthcare professionals remain a key partner in collaborating with patient advocacy teams to support people affected by CLL outside of their tertiary treating centre, and that we are proud of our first global directory of CLL support services and resources that can be used by anybody, which was launched in June 2022. I'd like to acknowledge all participants who took part in this survey and thank them for their contribution, as well as the grant funding through AstraZeneca, Janssen, AbbVie, and Lilly that enabled us to undertake this work. If you'd like to know more about this work or visit our resource hub, it can be seen with the contact information below. Thank you again for the opportunity to represent this piece of work.